Thank you all. I'm so glad we were able to share some really practical strategies to prioritize self-care for the care partner. Up next, we'll hear from Tom Manak, care partner and member of the People with Parkinson's Advisory Council at the Parkinson's Foundation. He and his wife of 43 years, Ro, have been fighting Parkinson's disease for almost 30 years. He has been Ro's 24/7 care partner since 2014. Tom is going to talk to you about the Aware and Care Initiative and what you can do to be prepared for a hospitalization, which feels especially important lately. With that, I will turn it over to you, Tom.
Good afternoon. I've been my wife's care partner since her diagnosis in 1990. However, my role expanded significantly in 2014 after her DBS surgery, and I am now her 24/7 care partner. During that time, my wife has had 4 hospitalizations, admissions to 3 acute rehab facilities, 1 acute subacute rehab, 2 overnight observations, and all of that in 13 months. Being prepared for a hospital visit is an important issue for me and my wife. To help people affected by Parkinson's, we need to understand the risks associated with hospital stays, get tools to play an active role in their care, be prepared for a hospital visit, whether it's planned or unplanned, and develop strategies to get the best possible care in the hospital. The key is to get the right meds on time, every time, and it's to be aware in care. Everybody assumes hospitals are safe. Staff will understand my symptoms. The pharmacy will have my Parkinson's disease medications. They will call my movement disorder specialist. They'll bring me my meds on time, every time, and they will know the drugs that are unsafe. Those are the assumptions. But don't forget, people with Parkinson's disease are hospitalized 44% more than their peers without Parkinson's. People with Parkinson's suffer avoidable complications at a higher rate than non-PD patients. This yields longer hospital stays than non-PD patients. And the longer you stay in the hospital, the more opportunities there are for bad situations. Without your right meds on time, every time, you may have a longer length of stay. Staff doesn't do this intentionally. There are approximately 1 nurse for every 6 patients during the days and more patients in the afternoons and nights. One thing to know about, on any given day, 1 in 31 patients has at least 1 healthcare associated infection. It's not something any of us want to have when we're in the hospital. Why don't we get our meds? Even in the best hospitals, there's a lack of understanding of Parkinson's disease. Non-Parkinson's disease specialists may not be fully aware of critical importance of Parkinson's medication timing. And hospital pharmacies may not stock all PD medications. Hospital staff may not know that many common medications are contradicted for people with Parkinson's disease. It's assumptions we make, and they may not always be true. There's a lack of awareness of the critical importance of Parkinson's medication is timing. Many common medications for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. And poorly managed Parkinson's might result in mental confusion and other serious symptoms. All of this can result in longer hospital stays, which is risky for all patients. Every person with Parkinson's disease has a unique combination of medications and listed regimen. You all know that once you've seen one Parkinson's patient, you've seen one Parkinson's patient. That each person with PD has the best knowledge of their disease and other conditions. And they are the most knowledgeable about their own special needs, but may have communication challenges. And each person with Parkinson's disease and their care partner may be the only people who have all the necessary information. You must be ready and prepared with everything documented for the caregivers. We must advocate for the person with Parkinson's. Don't be afraid to speak up, don't be intimidated, and don't back down. Aware and Care is here to help. The Parkinson's Foundation Aware and Care campaign can help everyone be better informed. The person with Parkinson's disease, the care partner and family, healthcare providers, doctors, nurses, physical therapists, respiratory therapists, speech therapists, and other hospital staff. The Aware and Care Kit helps prepare for the hospital stay and get the best possible care. A couple of stories I want to tell you about. One person I talked to said it took 2 days to get my hourly carbidopa-levodopa doses, and the hospital president stopped by my room because of the problem. That patient was my wife, so I was very involved in that care. Another friend of ours with Parkinson's disease said, my husband is a surgeon at the hospital, and everyone knows I have Parkinson's disease, but after my back surgery, they gave me medications that were contraindicated for my PD. Luckily, I was aware enough to tell them no. And the key is, luckily, she was aware enough after her surgery. There may be complications of the surgery related to how quickly you come out of anesthesia, but she was lucky. What we want to talk about is what's in this Aware and Care kit. And let me show you what it looks like. This is the Aware and Care kit. It's a little bag that's provided by the Parkinson's Foundation. Within that kit, you get a hospital action plan. The hospital action plan is a booklet that talks about what you need to think about in order to prepare for that hospitalization. It makes you ask questions and add things to the kit just in case you need more information. But it also provides a Parkinson's disease medical alert bracelet. It's something that everybody with PD should be wearing. And I will admit, my wife doesn't wear hers that often, but you have it and there's no excuse for it. You get a medical alert card. That medical alert card you can provide to any of the caregivers if you want and just have it with you. There's a medication form. Like I said earlier, everyone has their own medication regimen. And also it's the most current one that you can have with you. Even if the hospital has an electronic medical record and you're in it, it may not be completely accurate. So fill that out and have multiple copies. There's a Parkinson's disease fact sheet. Again, more information for the people caring for you. There's also a number of I have Parkinson's reminder slips. These slips you can hand out to everybody. There's 25 or 30 of them, and just keep on handing them out to let everybody know that you have Parkinson's disease. There's a magnet. You can attach it to your bed or wherever there's metal to remind people to get your meds on time every time. And there's also 2 sheets for precautions, one for those of you that have DBS surgery and the other one's with Duopa. It's just some additional information for the caregivers. The next thing to think about is you saw that the kit, there's a lot of room in it. What are other things that you should add to it? Add identification cards. Remember, one of the things that may happen is the first thing that'll happen is that they'll ask for identification cards and insurance cards. So include both. Include your medical history, contact information for your physicians, and your medical history, your hospitalizations, anything that can help those providers give you better care. Bring your meds with you in original bottles, since the pharmacy will want to take a look at them, see exactly what they are, but also bring some extra with you because sometimes it can take 4 to 5 hours for the pharmacy to get the meds up there, and you'll want to take them when you need them. Include your medical power of attorney, a HIPAA release, because sometimes the care partner is not with the person with Parkinson's disease, and this way those providers can talk to the people that are there. And if you've had DBS surgery, you can get information, for example, from Medtronic that provides the information about the DBS. And also from your neurologist, you may be able to get what's called an MRI eligibility sheet, identifying what type of MRI you can have, what the limits of time are for the procedure. And most importantly, anything else you can think of, because it provides the best information you can have so that you can get the best care possible. You can get in the hospital, have the issue taken care of, and get home. So the key is get a kit, do it now, know the facts, and be aware and care. You can order by phone at 1-800-473-4636, order by email at helpline@parkinson.org, or order online at parkinson.org/awareandcare. Thank you, and good luck.